Hi, I'm Adina Hildebrand. I'm the inventor of the Pain Relief Orb. I designed the Pain Relief Orb for targeting chronic pain. This here is the Pain Relief Orb. If you look at it, it's got 6 ends on it. So the very largest nodule, that's called the nose piece. The sides are the ear pieces and they don't stick out quite as far, so there's less pressure. On the top is the bump, and that's used for areas that are harder to get at and you need a smaller nodule. The bottom is the 2 nodules together are the feet. So the 6 ends on the orb, each nodule is designed for a specific area of the body. The largest nodule, the nose, is designed for the glutes. So if you have chronic pain in the low back region, or you have sciatic nerve pain, you would use this in your buttocks area by just sitting on it or laying on it and staying in that position for 3 minutes. These ears, they don't protrude quite as much, so if you're requiring less pressure, those are the ends that I would suggest. On top, the bump is used for harder to get areas that require a smaller circumference. So I use this in my rotator cuff or just other areas of pain. And you can just play with each end and find which end suits you best. The 2 bottom that are the feet, those are designed to go on either side of your spinal cord. You can use it with a little bit of oil so it slides nicely and it'll find your trigger points. Any area of pain, again, you just apply pressure for 3 minutes. So I just want to demonstrate to you how you would use the orb at home, and I'm just going to have Lindsay come help me demonstrate. So if you are at home and you have some pain in your thoracic spine, you would hold the nose piece like this, and with the feet facing along your back, you would run it down here on either side of your spine, and when you find an area that's sore, you would just apply pressure by leaning against the wall. Now the more pressure you get is by putting your feet further from the wall. If you want less pressure, you would have it closer to the wall. And you would just rest on there for 3 minutes. Then you would just change position again, lean against the wall or the back of a chair. If you're doing this in bed, you would just sit up, kind of find your area, holding the nose piece again, and then lay down and just tuck a pillow under your head. If you're doing your neck, you would remove the pillow and just apply it along your neck and just lean into it when you're in a lying position. Again, 3 minutes and release. Now the areas above, on the tops of your shoulders, you would need the help of a partner. So you would just, either using the nose piece or the bump, you would just apply pressure with the help of an individual. Again, 3 minutes and release. Find another area of stiffness or soreness, apply pressure, and again, release.
My name is Tyler Muir, and I'm a registered massage therapist. This is my client, Marty. She's going to help me demonstrate the Pain Relief Orb in massage therapy. So I'm going to demonstrate for you one of the main areas that I have troubles with while I'm working on a client, and that's the glute region. One of the problems is that the muscles in the glute region are so big that in order to give a proper treatment, I'm having to really apply a lot of force, which puts the joints in my hands in danger. So having a tool will allow me to sustain a longer work life and also hopefully give a better treatment. So using the big knob on this, I like to just gently apply pressure into my client, obviously always getting feedback, until I find a proper amount of pressure. Now all the things that I need in order to do a massage are still going to come into play. All of my work experience, all of my knowledge, but what this is going to do is it's going to stop me from using the small joints in my hands. Something I also notice is while I'm using it, there's a knob on the back here that also gives my hand a nice little massage while I'm treating my client. So, another common technique in massage therapy is stripping the soft tissue. One of the main areas that I'll be working on, especially with this client, as she's pointed out, one of her sore spots is her mid-thoracic spine. So using one of these small nodules, I would apply oil on the client. The benefit also with using the rubber is that it's easy to clean once I'm done working on my client, It also has very little friction. So with a little bit of oil applied to the surface of the skin, I can use the tool just to gently strip the soft tissue all the way up the spine.
So another area the orb is useful for is the feet. If you've come home after being on your feet all day, your feet are tired or sore, you would just place your foot on top of the orb, bump facing up or the feet facing up, apply pressure, again for 3 minutes. And move your foot to a different position, press down, 3 minutes, and release. So when you're sitting on a chair, you can use the orb underneath your buttocks, and that will help with your low back and your sciatic nerve pain. You would just place it underneath a cheek and just sit for 3 minutes. Move it to a different area of pain, and again, sit for 3 minutes.